This video is to demonstrate that Rosai-Dorfman looks like some type of lymphoid collection from low power. But when you go in on high power, you'll be able to see a cluster of what appear to be small lymphocytes and larger histiocytes. So these really small compact nuclei with the homogeneous purple nuclei here, those are the lymphocytes that are being engulfed by these larger cells, which share kind of an eosinophilic cytoplasm. It's a little bit less eosinophilic or more pale compared to these eosinophils that you see in the biopsy too. And this is an interesting case of Rosai-Dorfman that has a lot of eosinophils, but you don't have to have all of these eosinophils. And it would be pretty difficult just to make this diagnosis on H&E alone. And so in real life, you will want to do a confirmation stain of S100 to highlight those histiocytes and show that they're engulfing the smaller lymphocytes. Also, if you're considering a Langerhans cell histiocytosis, then you'd want to do a CD1A to make sure that's negative, because remember, Rosai-Dorfman is a non-Langerhans cell histiocytosis. But the thing that it does share in common with Langerhans cell histiocytosis is that it has S100 positive cells. So just remember that Rosai-Dorfman is a non-Langerhans cell histiocytosis that can stain positive for S100 among the histiocytes that are engulfing the lymphocytes, and that's called emperipolesis. Here's a CD1A from the specimen just to show you it's highlighting endogenous Langerhans cells in the epidermis, and you see those nice dendritic processes of the normal Langerhans cells, but it's negative within the neoplasm. And here's your S100 stain, so diffusely positive among large cells within the neoplasm, or within the collection, I should say. And I just was going to highlight an example of the emperipolesis that you can see a little bit easier on S100 stains. So I'm circling a large histiocyte that's engulfing these small lymphocytes, and you see the blue nuclei that are not staining for the lymphocytes. Not positive for S100 here on the lymphocytes, but around it, the cytoplasm of the histiocyte is diffusely positive for S100. And you can look around and see some empty holes where those lymphocytes are filling in the cytoplasm as they're being engulfed by the histiocytes. So this is just a really nice example of an eosinophilic rich Rosai-Dorfman, and just appreciate the S100 staining because in real life, that's what you're going to need to make the diagnosis. But on the exam, they'll probably give you multiple different types of answers that could look similar to this. And so, you know, if you were looking at a reticulohistiocytosis, for example, you would go in here and kind of make sure that these histiocytes don't have abundant two-toned cytoplasm, and we'll show a different example of that in our in a different video. We'll show you examples of the reticulohistiocytosis. And you might think some type of infection from low power because it's so dense. So make sure that you don't see anything like intrahistocytic organisms like leishmaniasis or histoplasmosis. You might be thinking some type of fungal infection, so make sure you're not seeing any spores or hyphae. You might think about a angiolymphoid hyperplasia with eosinophilia because you do have so many eosinophils in here. However, you know, you don't have that much of a vascular proliferation. This is all you really have here, but there's a little bit of hobnailing here, so I could understand how you might get a little confused on that, but it shouldn't be positive for S100. And you can actually appreciate the emperipolesis on H&E if you look carefully enough. So that's going to be one of the key features to make the diagnosis on H&E alone. Another key point about making the diagnosis of Rosai-Dorfman is from low power, you think it looks pretty lymphoid. you need to be thinking about Rosai-Dorfman, because typically they can look like lymphoid tissue in the skin. And if you convince yourself that you're not dealing with a B-cell lymphoma, that's going to be very useful, or any type of lymphoma, and you're left with a histiocytic process, then you can, by process of elimination, get to the answer of Rosai-Dorfman.